Hey, it's Dr. Jarrett. I told you guys, I can't believe the luck I've been having over these past few weeks. It is amazing because I keep running into amazing international pediatric people. I'm with Dr. Terri, MD. She is a neonatologist. She takes care of preemie babies, and she actually has a new book that I'm going to want to ask her about in a little bit. But I tell you, it is unbelievable of all the things and people that I'm wandering around Dallas. I actually see Dr. Terri, and I had to stop her and see if she would do a quick 2 Cents Tuesdays bonus for you guys. You guys know who I am. I'm Dr. Jarrett. I'm your board-certified pediatrician and here to help your children's behavior and better health. And I'm doing this through my books, my 2 Cents Tuesday show, and other programs I have forthcoming. So I want Dr. Terri to tell a little bit about herself before we get started.
Hey, 2 Cents Tuesday family. I'm excited to be sitting here with Dr. Jarrett, too. He's internationally renowned as well. I am Dr. Terri, MD. I'm your board-certified neonatologist and pediatrician, and I specialize in giving families the gift of hope through my books, my webinars, my seminars, and my speaking engagements. I also help providers help families navigate difficult choices that they have to make in the ICU nursery. And I'm super excited that Dr. Jarrett's in the Big D, Dallas. Woohoo! I'm originally from Louisiana. I don't know if we have any Louisiana fans out there today. Hey, Asher.
So hey, Asher, how you doing? Thank you for tuning in. We really appreciate you tuning in. I told you guys to set your notifications because I'm going to be popping on anytime. It's not just going to be Tuesdays at 1 p.m. as the normal show time. If I see somebody you guys need to hear from, I'm going to give it to you, and I'm going to give it to you right when it happens. So thanks for tuning in. So one of the things that I'm so impressed with that you've been dealing with lately, Dr. Terri, is your book. So in neonatology, you take care of very young infants. You're taking care of babies that are could be very sick or very premature, and you're doing this all across the country. You work in many different states. I know you're very busy, so thanks for spending a little time with me. But Early Arrival, your book, is really amazing. I had the chance to read it recently, and it is really a step-by-step guide of things that parents should know when their baby is in the NICU. So could you tell us a little bit about Early Arrival?
Yes, Dr. Jarrett, I love to. So as he mentioned, I'm a neonatologist and I take care of premature babies. And if you have a premature baby, you weren't planning to have a premature baby. Many times you've done everything right. You've seen your OB, you're minding your business, your water breaks, and your baby's here. It's April and your baby's not supposed to be here until June. So when you first have a baby that's 1 or 2 pounds or 3 pounds or 4 pounds and you bring them into the ICU nursery, it's very overwhelming. Your oldest was in the NICU? Wow, Asher. So you probably know exactly what I'm talking about. So it's very overwhelming. And so even though doctors are talking to you, nurses are talking to you, it's scary. You have a really tiny baby that's in the ICU nursery, and it's a lot of alarms, it's a lot of lights. It's very scary, and so it's hard to remember what they're telling you. So this book, the reason I wrote this book is because I know what it's like to look into the eyes of someone whose baby is here very early, or even if they aren't early, they're very sick. And I want parents to know the main things to expect in those first 24 to 48 to 72 hours. So this book is only 80 to 90 pages, very easy for parents to read. We talk about what's in the ICU nursery, what equipment are we using, who is taking care of your child. It's so many people. It can be 6, 7, 8, 9, 10 people. We talk about everything that could happen with the baby from head to toe. I always use a head to toe with my families. We talk about the brain, the eyes, the lungs, the stomach, and most importantly, we talk about how can you bond with your baby, because it's scary. I mean, sometimes they're so tiny they don't even really look like a baby, but you are still the parents. Oh, Asher, that's great. I'm really glad that the doctors and nurses, between the doctors and nurses, everybody was amazing, because we want families to know that they are part of the medical team. I feel like parents are part of the medical team. So we want parents to be able to bond with the baby, to be able to touch the baby, to hold the baby, to do the kangaroo care. So we have a section about that as well. So 9 steps. You may not have gotten your 9 months, but we can give you 9 steps to get through your NICU journey. And that's my goal, that every family gets the gift of hope. Even when it looks like it's dark, we give you light for the journey. And that's what I try to give you in this book.
You're absolutely right, Dr. Terry. There are two parts of your book that really stood out to me. One was that you asked a list of questions that new parents, expecting parents, and newly delivered parents should ask the NICU team. So you've got to go check this book out. It's on Amazon, and it's going to be one of those things that's there. But the best part was really the last part. It's almost like a postscript you did in your book, and it really touched me because I lost several years ago my daughter Jasmine at the age of 25 weeks. So my wife and I went through a difficult time. It was an unexpected stillborn delivery, and we miss her every day, even right now. And as a result, your message at the end of the book really was truly something that was special to me. Would you mind telling us a little bit about that?
I love to, Dr. Jared, and I'm sorry for your loss. And I love the name Jasmine, your sweet angel baby daughter, Jasmine. So the end of the book to the 2 Cents family is so important to me, and it's a passion of mine. I do a lot of neonatal palliative care, and I have to help families who have to say hello and goodbye. So most of our babies do leave the ICU nursery, but not all of them leave the ICU nurseries. We see many miracles, but I meet angels every day. And those families need someone to hold their hand too as they navigate that process. So the very end of the book is dedicated to those families who have to say hello and goodbye to their infants. And so in that section, we talk about ways that families can say goodbye, hello and goodbye. We talk about how important it is that they have time to hold their babies. We talk about if there's a special outfit they want the baby to have, if we can do photographs, footprints, if they have a faith preference, if they want the baby to be baptized. These are things that we don't often take the time to talk about with families. But even in saying goodbye, they still have choices. They get to choose how they want to say goodbye to their baby, how long they want to hold their baby, how long they want to love on their baby. And I think that's so important. And I've been doing this 20 years, and I would say the most cards and letters I've received are actually from families who have angel babies, because I took the time to give them the time to say hello and goodbye, to use their child's name. So I use a child's, no matter how early the loss is, they're a child. I don't refer to them as a fetus. That's somebody's child. And somebody became a mom and dad today, even if their baby didn't stay with us as long as we would have liked or hoped. So I'm really glad you asked about that, because the end of the book is so important. And I don't think we talk about this enough for families who have to say goodbye or who have to go through stillbirth, because that pain continues even after they leave the hospital and after they leave the nursery, and they remember that baby's always a part of their family. So the baby's a part of my family too. Thanks for asking.
Thank you, Dr. Terry. Jasmine is certainly our angel and someone that's always going to be with us. So thank you for writing that book. You have to go get a copy of Early Arrival. It's out there. It's on Amazon. You can get it in all different places. You know who I am. I'm Dr. Jared. I'm your board-certified pediatrician who is here to help you guys get a better control and better health over your child. And I do this through my books, my programs I have forthcoming. So just stay tuned to 2 Cents Tuesdays, and we'll let you guys know where and what is coming next. In fact, we'll do an in-depth session next week of things coming up. I know Dr. Terry has to go. She has an appointment that she has to get to now for another consultation. However, I'd like to let her have the last word so she can tell everybody where to find her book and where to contact her.
Thanks, Dr. Jared. Thanks, Asher, too. Hey, Brad. You can get the book at Dr. Terri, MD, so www.Dr. not D-O-C-T-O-R, like Dr. Jared over here. Just Dr. Terri, TerriMD.com. Or it's, hey, you're welcome, Asher. It's Terry with an I. A lot of people spell it with the Y, so I'm glad you said that. Thank you so much. I appreciate that. I need all the prayers and the blessings. So www.DrTerrimD.com. That's right, Asher. Or you can get it on Amazon, Early Arrival. So on Amazon Early Arrival, you can get your Kindle copy, you can get your paperback copy, or if you order it from the website, you can get an autographed copy from me. And this book is good for anybody who knows someone who's going through bed rest because they may have a preterm baby. Anybody who already has a baby in the ICU nursery, it's a very quick read. It can fit in mom's purse or diaper bag or dad's pocket. And even if you haven't, you can get a couple of, if you know someone who's there, you can read it yourself so that you can support your friend or family member better. And especially if they've experienced loss, I find the end chapter very helpful to support families who are going through that so that they can be advocates for themselves as well as their children. Thanks for having me, Dr. Jared, and I hope you have fun in Dallas.
Well, I definitely will. I have a few things I have to attend to, and thank you, Dr. Terri, for spending some time with my viewers. And I told you guys, just keep your alarms and notifications set, because anywhere I pop up, 2 Cents Tuesdays may have a bonus. It might be a Wednesday, a Saturday. You guys know. So thanks as always for tuning in, and we'll see you guys next time.
Bye-bye.